Hello, I am Eli Adashi, Professor of Medical Science at Brown University and host of Medscape One-on-One. Joining me today is Dr. Téa Collins, Executive Director of the Non-Communicable Diseases Alliance, a Geneva-based advocacy organization. An expert in the practice and policy of global health, Dr. Collins joins the Alliance at a critical time in its relatively brief history. Welcome.
Thank you.
It is wonderful to have you.
Thank you very much.
Perhaps in the best interest of our viewers, we could start by defining what comes under the heading of non-communicable diseases, and then we can go from there.
Definitely. Well, I think the title is somewhat unfortunate because when something is called non, it already means that it's not really very important. So non-communicable diseases, it's a relatively new term. We used to call them chronic conditions, chronic diseases, and I think the physicians are still more used to this term. The reason we say non-communicable diseases in global health right now is that because some of the communicable conditions became chronic, let's say HIV/AIDS, TB. So to distinguish and differentiate somewhat, we say that these conditions are not communicable when we're talking about cancer, diabetes, or some chronic respiratory infections or cardiovascular diseases. So we say NCDs. We thought a lot whether we wanted to continue calling it non-communicable diseases, and exactly because of this reason that it's non, now the consensus is to say just NCDs.
So it would seem that even if imperfect, the term has stuck by now.
Definitely.
And everybody's using it, and so it's too late to go back. Is there a common thread that nevertheless in some way unifies this seemingly disparate group of conditions? You mentioned heart disease, lung disease, cancer. Are there elements that undergird, if you will, all of those in some way?
The reason we group them together, again, in public health, probably from a medical perspective, we won't necessarily put them in the same category, but they do have this common, so we say, shared risk factors that are easily modifiable with lifestyle changes. For example, tobacco control or reduced alcohol consumption, healthy diets, and exercise. When we do this, then we pretty much prevent all four. Which is a convenient catch-all, but in real life it doesn't work this way. And another reason these four conditions are grouped in the same group is that there was WHO report in 2005 when it comes from the World Health Organization, basically, when they looked at the burden of global disease, and they realized that almost 60% of all deaths are caused by these four conditions, and 80% of these deaths are happening in low and middle income countries. So we realized that these four diseases are really responsible for the global disease burden. And it made sense from the public health perspective to address them as a group.
Is it accurate to say that more people die of NCDs than die of the conventional communicable diseases?
Probably it is, because these diseases are responsible of 2/3 of deaths. Some people say, incorrectly I would say, that you have to die from something, and actually it's a good thing if you die from these conditions because they're diseases of aging, which is not correct, and the most recent evidence suggests that what we fear is the premature preventable deaths. These are the conditions that affect young and old alike. They affect rich and poor. So this is why it's really a global emergency, and hence the high-level meeting. It is a challenge, and it's not only a medical challenge, it's a developmental challenge. So, and I guess we still need to convince some skeptics who are not part of this community that it is a developmental challenge because it has some economic consequences. We know that poor people suffer disproportionately, and not only in developing countries, but also in rich countries, people who don't have access to healthcare, people who don't have good lifestyles, who cannot afford medicine or healthy food, they do suffer disproportionately. So this is why we say that it is a developmental challenge. And hence the high-level meeting, which is a meeting for the heads of states, it's for governments, because the global emergency really requires a global response.
We mentioned that over 60% of global deaths are attributable to NCDs. Have there been quantitative or semi-quantitative estimates of the economic impact of these diseases now and going forward towards 2030, maybe 2050?
Definitely, there were some attempts before, but most recently there are two studies out there. Actually, World Economic Forum just launched their new report. That was a couple of days ago at the General Assembly, the summit meeting. There are like two studies that are the two different sides of the same coin. The World Economic Forum study was conducted in collaboration with Harvard School of Public Health. And they estimated the cost of inaction. So what's going to happen if we continue the same way? Of course, we're doing something about chronic conditions and non-communicable diseases, but it's not enough. And it's billions of dollars lost due to economic productivity, which is obvious. And then there is World Health Organization study, which estimates a cost of action. What is going to happen if we scale up the interventions to address these conditions? And there are two kinds of interventions, population-wide, which is public health measures, and they're as simple as tobacco control, alcohol control, healthy diet, physical exercise, and then there are individual level interventions that for physicians translates as basically it's the medical care. And in medical care, we just talk about from general counseling to giving multi-drug therapy to patients who are at high risk of developing cardiovascular conditions. And the cost is really minimal. It's just amazing when I haven't had a chance to really study these reports, but off the top of my head, I can just give you some numbers. Cost of individual interventions ranges between $1 and $3 per capita. Mm-hmm. And then cost of inaction is just billions of dollars, and it's around $25 to $75. So there is a significant difference. So it really pays off from the economic perspective to do something rather than just wait and see what happens.
And it helps to know that the amounts involved are not such.
They're not huge.
That would be impractical in the face of some of the economic challenges that the world faces and the various donor countries face.
Definitely.
And so the more manageable the costs are, of course, the better the outlook for action, it would seem.
Definitely. I just wanted to add also that we all understand now that, due to financial crisis and there is some donor fatigue as well, there is less investment in health. But every government has some health budget. And it's really important for member states to realize that it's important how you prioritize and where you put your money. And you need to really know the epidemiological situation in your country and decide if this burden of disease is really big. You really need to put more money in, let's say, NCDs or some other program. But it doesn't mean that the programs have to compete. It's just important to know where your priorities are.
The organization that you head is about 2-3 years old. And yet, it has had a remarkable effect on the process that led to the high-level meeting, which is transpiring as we speak. Tell us a little bit about how you did it and what's in store for the organization now that the meeting is transpiring and hopefully producing some results which we can discuss a little bit later.
Definitely. Well, NCD Alliance, it's a really young organization. It started in 2009. when there are 4 major disease-specific organizations. There are global federations, International Diabetes Federation, Union for International Cancer Control, the Union Against TB and Lung Disease, and World Heart Federation. So these federations represent the 4 diseases that we're talking about. And they realized that they were much stronger together to address the NCD challenge. And it's a remarkable cooperation where these 4 federations got together and formed the NCD Alliance in 2009. And initially they operated somewhat informally. And their major requests were basically 4 main asks, as they called. First of all, they wanted the summit. They realized that this is basically the second health summit after 2001, when the first one was on HIV/AIDS, and we know that after that there was a whole change in the global health landscape. So the first request was they wanted the global summit to really put the issue on the global agenda. The second one was simply NCDs into MDGs, Millennium Development Goals, because we know that Millennium Development Goals do not have a target on non-communicable diseases. They just refer to control malaria, TB, and other diseases. And
should
there
we consider that an oversight at the time, or unawareness, perhaps?
I guess it wasn't perceived as an emergency. I guess non-communicable diseases, other than being non-communicable, they're also chronic. And people do not perceive it as an acute emergency, especially at this level. So I guess UN at this highest level didn't perceive it as a challenge to development until recently. So that was another ask, and then 2 more were access to medicines. They have to be affordable and available to everyone. The 4th one was strengthening health systems. And then relatively recently, in January, we recruited a team. So NCD Alliance team is very, very young. It's only 9 months old. And then we started operating more formally, and we were joined by partners who are also like-minded non-governmental organizations devoted to the cause. And we have about 10 partners all over the world, basically, mainly in the U.S. and in Western Europe. I can list them if the time permits, but it's been really remarkable because now we represent about 2,000 organizations in over 170 countries. So it's a pretty big group of organizations that represent the voice of civil society. And we're also working with our common interest group, which is about 400 organizations all over the world. Some of them are in health, some of them are in health-related fields, but with a very strong interest in NCDs. So this is how we came to be, and the Summit project was the main thing, Summit campaign, of course. But I would also like to mention that we do some technical work as well, because we need some evidence to support our advocacy. And advocacy methods, they're getting increasingly sophisticated. We do need to be research-based, and we need to have arguments that politicians understand. So we have working groups. So some, probably medical profession is particularly interested in that. We had working groups of people from academia and other civil society organizations that are working in the field. I would name a few: Harvard School of Public Health, Management Sciences of Health. We had organizations working with children, because this is one of the issues that it doesn't really come to your mind when you're talking about non-communicable diseases, that children are actually affected too. There are congenital malformations, there is rheumatic heart disease, there is asthma, just a whole myriad of problems. So this working group started producing papers addressing different issues and just showing really the multidimensional character of NCDs, because you have to really reframe the issue to start thinking about it differently rather than just aging and escalating health system cost.
Yes.
So it's been really remarkable to work with basically everybody in academia, also we have private sector supporters, and seeing all these different perspectives on the same issue. But we also understand that to really address non-communicable disease, you need everybody on board, starting with patients, finish with health system, medical profession, private sector, industry, you name it. It's everybody's business.
By all accounts, what will happen going forward will, to a large degree or in part, be determined by the outcome of the high-level meeting or the summit, and specifically the political declaration that is the deliverable of such meetings. As we speak, has the political declaration been finalized, or it's no longer in draft form then? Has it been ratified, or is that still to transpire?
That's a great question, and I'm pleased to announce that it's been adopted yesterday, which actually it was adopted yesterday. So it's already there, it's not draft anymore. And it was a nice surprise in a way, because normally political declarations, there was a political declaration too after the General Assembly on HIV/AIDS. It gets adopted after the meeting is over. But yesterday after the plenary, it was announced that if there were no objections and countries were all for it, that basically was adopted the way it stood at the time. And I think it's great news. I think it's also important to adjust our expectations somewhat, because the political declaration by no means it's not politically binding, but legally binding. But it is politically binding because governments committed to it, and negotiations were really tough. I guess I need to explain how this works. Member states basically negotiate that whatever goes into political declaration, and they negotiate it in groups. Let's say EU negotiated it together. Then we had G77, which is over 130 countries, but they're also negotiating in bloc because it's stronger this way. So it does represent a global commitment to action. It's a very good and strong document. I would say it's not perfect, but hopefully now it's time that member states start implementing the commitments they made.
What about the document do you find is strong, helpful, in keeping with your aspirations and expectations?
I think it's strong in a sense that it really recognizes the magnitude of the problem. Even the use of word epidemic, we really fought hard for that, and civil society was pushing hard to make sure that this word stayed in the declaration. It got dropped several times. It's just funny how every word means something, and every word got there because somebody fought for it, whether it's the government or NGOs. So it was a really collective effort to some degree. I just don't want to mislead our audience. We didn't negotiate clearly. It's all up to member states. They are the ones who negotiate. But clearly civil society is engaged and is trying to influence country delegations or their countries on the ground. This is how we worked. We work through our member organizations who work with their governments, and we were trying to also pass our objections or support when the negotiation process went in force. And we also worked with the missions to the UN in New York and tried to educate them and just to pass on the civil society's requirements. It was a very tough but also enjoyable process, and I think the summit is now somewhat a celebration because the declaration has been adopted, but now it's time for action, and I think the most interesting time now, and it's just the beginning.
Are there elements of the declaration that fall short of your expectations and hopes for the summit?
One of the main things that I would like to mention is probably the targets. And again, if we make comparison with the AIDS declaration 10 years ago, the outcomes document, a political declaration, had really well quantified targets and commitments, which was more binding and a little more clear what's going to happen in the near future. Right now, this political declaration calls for these targets and urges WHO to develop them. So there is more to come, but there are no numbers. There are no global commitments. Let's say reduce mortality by 20% by 2025.
Unlike the Millennium Development Goals, for example,
Definitely.
there are no measurable endpoints.
It's not there. So it's been somewhat disappointing, but it's also understandable because countries didn't want to rush and commit to something that maybe they won't be able to implement. It's also important to differentiate between global targets and indicators that are more aspirational, but also national targets that are something that's more doable locally. So this still has to be worked out. Another somewhat weak point is on partnerships. NCD Alliance was pushing hard to make sure that there would be formed some kind of partnership that would involve the UN, the NGOs, the private sector, where we all come together as a monitoring body and just make sure that commitments are being implemented and also offer some solutions.
For which there are precedents in other areas.
Definitely.
Yes.
And in terms of multi-sectoral action, I would just like to mention that the political declaration calls on WHO to consider, I think I quote, to consider options, how this partnership's going to look like, and submit this proposal to the General Assembly in May 2012. So there is hope, and I guess we have some window of opportunity there to lobby hard and to work hard and make sure that everybody is on board. And by everybody, I mean governments, non-governmental organizations, academia, and the private sector. I think it's critical that the private sector gets engaged because they are part of the solution.
Among other things, the weight or the impact of a high-level meeting is judged by the presence or absence of heads of state. When it was all said and done, how many heads of state ended up attending the high-level meeting?
I guess that remains to be seen. We will get more accurate information after the summit is over. Today is the closing plenary. As we speak, it starts in about 10 minutes. But right now, we know that there are at least 34 heads of states and pretty much every minister from every country, because I attended a Roundtable 3, which was on international cooperation. I'm just coming from that meeting. And it was remarkable. Member states are making statements, and pretty much every statement was made by Minister of Health. So it's a very good sign that Ministers of Health are engaged. But again, I need to emphasize that it's a developmental meeting. It's a high-level meeting. It's for heads of states, and we do want the commitment at the highest level. So 34 presidents is not bad. We were hoping that maybe presidents of the United States will be interested in attending, but I guess it wasn't possible. But it's also important to set the example, and member states are also watching each other and see who is really committed. But I think 34 is a good number so far.
34 heads of state, 193 member nations, and a substantial number of health ministers really making up the difference. Briefly, before we close, how do you see the next 5 years unfold in terms of the NCDs, the timeline, the milestones that we ought to be looking for, the actions that you would hope would transpire in the next 5 years?
I guess we have to differentiate between global and national levels because action is required on both. And again, every actor has to do their homework. At the UN level, as I mentioned already, it's really critical to work on targets, which is right now WHO's job. They have to develop some global targets and submit it to the General Assembly by May 2012. At the same time, at the UN level, we're still hoping, UN I mean the headquarters level, General Assembly level, we're still hoping that they would consider including NCDs into Millennium Development Goals. Probably it's too late now because they expire in 2015. But definitely there will be some other goals. I don't know what they will be called yet, but it's really important to have them, NCDs at this level. So this commitment will be important.
So correcting the oversight or
definitely that took place 15
back
years
in
ago.
2000, yeah.
Almost 15 years ago.
Yes.
And but the action really will be at the national level. Member states have to implement that. This is not to say that we are not, globally, we are not doing anything on NCDs. Clearly, when the patient gets sick, they have to go to a clinic and get some kind of care. But at least it's really important that there are more resources. First of all, there are no commitments right now to have some additional money flowing into NCDs. But integration and coordination is the key. At the primary healthcare level, we all know that you can easily integrate NCDs with infectious diseases, especially in low-income countries. You can train physicians differently so they can recognize and address this issue. You can transform the whole curricula and include this in the training. You can strengthen health systems. There are lots of things that can be done to improve the overall outcome. But more importantly, it's really important to involve all the sectors, not only the health sector, but food and beverage is really important, agriculture, transportation, finance, because NCDs really, really are something that everybody can do something about it. So I think now it's kind of time to roll up our sleeves and get to business, and from time to time step back and see where we are.
It would seem that the good news is that there are numerous cost-effective interventions, including integration of NCDs with communicable diseases and many others that you mentioned, that should allow us to witness some progress in the years to come. In closing, and on a more personal note, if I may, I couldn't help but note that you are a global citizen, born in Georgia, educated largely, perhaps not exclusively, in the United States, living in Geneva, conceivably.
That's true.
Could you fill in the blanks for us?
Well, I guess I go where my life takes me. I don't see any limits. I think people are the same everywhere, and where your opportunity takes you and where you can contribute most, I think you need to go there. Of course, I'm Georgian. It's my native country. I love it very much, but it has its problems. So clearly, with NCDs, there it's a huge issue. But I think it's more of a cultural thing there too. This is one thing that we don't talk much about. But when people are so overwhelmed with other problems, they think that health is not really a priority. So this is one of the issues. But I love the United States. This is my second country where it's like my native, not native, but I lived here long enough. I just love the U.S. culture. It's so embracing and motivating and forward-looking and energizing. So this is somewhere where I really love being. And being among American people. And Geneva is, I think, it's a humanitarian capital, and there is a lot of action there. And the World Health Organization is there, and NCD Alliance is there. So we feel that we're contributing a lot to this global fight against the NCDs right now. But again, my commitment is to global health, and I'm just willing to go everywhere where I can contribute significantly and do something about it, so we can really improve health and make people not only healthier but happier.
Thank you.
Thank you very much.
On this note, sincere thanks to Dr. Collins and to you, our viewers, for joining Medscape One-on-One. Until next time, I am Adashi.